Well, good morning, everybody. It's Christian, Advantage Medical Testing. What we're going to do today is we're going to do kind of a recap or an overview of the retail panels that we've looked at so far, and there's some mention of a couple that we haven't got to. This is an attempt to help you all figure out when you're talking with people what type of panel that you should recommend to them. All right? So let's go ahead and get started. This will be a refresher for a lot of people, but you may even learn something, those of you that have been sitting in the other retail panels. So we're going to get into some strategy here afterwards, but let's just really quickly go over to an overview quickly of what we have to offer for our direct consumer tests, retail panels we like to call them around here. All right. So those of you that are not aware, these are our retail tests at this point. And we always add more as they come available. So we've got the Diet and Wellness panel. That's the newest one to hit the streets. We've got the Diabetic Predict panel. That one's just new prior to that. We've got the Foundation Methylation panel, the Chronic Pain panel, the Men's and Women's Health panels, Developmental panel, the TBI and Post-Concussion panel, Autophagy panel, Neurological Psychological panel, the Gastrointestinal panel, Neurotransmitters, Detoxification, or autoimmune is how it's listed, Inflammatory panel, and of course our retail version of the Pharmacogenomic or PGX test, and the Cannabis Health test. These are what we offer, so you should be able to at least know what we offer to our customers. By the way, the Pharmacogenomic, the PGX test here, this is an exact, basically direct-consumer test that we give for the no-cost test. Also, our CGX alternative here would be the Autophagy. All right? So the Autophagy panel is the equivalent of our retail CGX. So we're going to just go through really quickly each of these panels. If you want to take notes, this will be recorded again if you don't have it. Diet and Wellness panel studies 27 SNPs. All right, who needs the panel? Pretty much anybody that wants to normalize their weight. Weight loss is the big factor, but some people, believe it or not, are trying to gain weight. This will help them do that as well. People that have fatty acid or cholesterol issues, people that are going up and down in their weight, the major weight fluctuations, and people that are currently taking supplements for their weight control, people that routinely diet, and there's a little cover up here, error, but chronic disease and inflammation. So people that can use this panel are pretty much anyone that's concerned with their weight, have been working on it, taking supplements to do it, and they're routinely dieting. They're, following these fad diets, the keto diet, the Atkins diet, so on and so forth, but they're just shooting in the dark. They're making their choices based upon television commercials and friend referrals. The Diabetic Predict panel studies 16 SNPs. And who needs this one? Well, pretty much anyone that's overweight, because when you look at fat people, myself included in that category, not to offend anyone, when you look at fat people, you're like, if you were to ask them, if they were to ask you, hey, what do you think my chances of getting type 2 diabetes are? You look at a fat person and say, well, it's like, no duh. Well, this is not necessarily the case. This panel's for anyone that's overweight, anyone that has a family history of diabetes, okay? People that are not exercising or inactive, people, again, that have that family history of diabetes, people that have a personal history of gestational diabetes, which is diabetes, of course, during pregnancy, people with high blood sugar levels, people concerned about their health and their family's health. Because remember, these are genetic tests. These are not just involving what you have to deal with. These are going to relate to people that you're going to be passing on your genes down to. All right, and then anyone with a desire to prevent type 2 diabetes. This is a great panel. I encourage you to go back and watch the video if you haven't seen it. This is an incredible panel. All right, this is an 80% accurate test that our lab here that developed this test has a 3-year exclusive right to market this panel. And then after that, it goes into the pool just like any other drug formula. This test is amazing, okay? The foundation methylation panel, it studies 25 SNPs, all right? And who needs this panel? Well, we haven't gone through this in our individual training series, but this is a great panel. People with mood or sleep problems. Does anybody know anybody with mood swings? Issues with fatigue. Anybody that's always tired? Neurological symptoms, that's a very wide open category. So anything neurological that they can benefit from this panel. Immune challenges, detox issues. Anybody that's concerned about the MTHFR, MTRR, or the FOLR mutations. The chronic pain panel, this one studies 23 SNPs. And who needs this panel? Well, you got it, man. Anybody that's claiming they have fibromyalgia needs this panel. Arthritis and joint pain, headaches or migraines, IBS, which is irritable bowel syndrome. Anybody that has a feeling of pins and needles. A lot of people with diabetic nerve pain can benefit from this test as well. Back spasms, stomach pain, and any kind of unexplained pain, okay? They can definitely benefit from these panels. Who else can benefit? Chiropractors. Chiropractors love this pain panel, okay? Let's go right into the men's health panel. This one studies 11 SNPs. And it focuses on the areas that are of most concern to men. And quite oddly enough, men will not buy this panel, in my personal experience. The people that buy this panel are the men's wives or partners, people that are concerned about men's health. It's not the men. So pretty much anybody that's interested in the overall health of men, then they have a general feeling of unwellness, a low libido, balding, weight gain, enlarged breasts, high blood pressure, fatigue or sleep problems, loss of strength. Now, so you can look at just these symptoms here of people that want this test. This panel then is going to go ahead and study what? Testosterone, heart conditions, especially with the blood pressure, because that's the number one killer for men, really, okay? So here we go. Next one, the women's health panel. Now, this one studies 23 SNPs. And that, and accordingly, this one's priced a little higher in store because it's looking at more SNPs. But this is for women that are dealing with irregular menstrual cycles, weight gain, history of PCOS, hair loss, any issues with the breast, tenderness, fibrocystic breasts, any women that are experiencing excess facial and body hair, postmenopausal women that are on hormone replacement, and then any woman with a family history of, look at this, hypothyroidism. Well, this can count as personal history as well. Hypothyroidism, infertility, miscarriage in the past, breast or ovarian cancer, obesity, diabetes, and preeclampsia. So we're going to talk about when these symptoms present across the board. They're like, oh, yeah, I have this one, this one, this one, and this one, and then you're trying to narrow down what panel to recommend. All right? We're going to talk about that. So we've got our developmental panel. And this one here, man, this is an amazing panel for kids. This studies 37 SNPs. And who needs this panel, right? Any family member that is experiencing any of the following: autism, spectrum disorders. That's right, anyone on the spectrum. Childhood ADD or ADHD, cerebral palsy, speech delay, vaccine reaction, and a family history or family member history of vaccine reaction. Dyslexia, dysgraphia, dyscalculia. Again, dyslexia is they have issues with their reading. The letters are mixed up. Dysgraphia is an issue with their numbers. Is an issue with them writing instead of reading. And dyscalculia is an issue with their numbers. All right? Kids with auditory processing disorders or childhood epilepsy. This is a very important panel. This can answer a lot of the why is this happening questions. This can give some really good recommendations on how to deal. Again, none of these tests are diagnostic tools. They're an attempt to help people deal with the issues they're currently having. Then we got the TBI post-concussion panel. This one studies 30 SNPs. And who needs this panel? Well, pretty much, when I'm looking at this list, I'm thinking athletes. Okay, high school age athletes, college age athletes, military veterans, anyone that has had a TBI. or post-concussion syndrome. Pretty much people that have had something, go on in their head, whether it be physical, emotional, some kind of a trauma. People that are trying to prevent concussions, okay? There's several athletes out there that have had multiple concussions, so they're great candidates for this test. People with headaches or visual changes after a head trauma, and hyperacusis. Google it. Okay, next thing. Autophagy panel. This one's going to go ahead and study 30 SNPs as well. And who needs this panel? This is the most exciting panel, I think, before they introduce the diabetic predictor and the diet and wellness, because this is one of the newer panels. It also got a Nobel, Prize because of this test. This is people that are dealing with autoimmune issues. Now, when you see that, you may ask yourself, well, wait a minute. We got this autoimmune panel. Why would I go with the autophagy? We'll get to why we would go with this one instead of that one here in just a few minutes. So pretty much anybody with any kind of an autoimmune issue, lupus, rheumatoid arthritis, Sjögren's, okay? Hashimoto's would even qualify in there. But we got hearing loss, detox problems, irritable bowel syndrome, can't say it, IBS, anybody with neurological diseases like Alzheimer's, Parkinson's, dementia, family or personal history, multiple sclerosis, and even autism, developmental delay. Here's the big thing. This is why we call this our CGX retail equivalent, because this is for anyone that has had a personal or family history of any type of cancer. The big difference is they even consider environmental cancers on this test, all right? The no-cost test does not consider environmental cancers. Anybody that's had type 2 diabetes, liver, kidney, or pancreas issues, and pretty much anybody over 50 should consider this test for any kind of a problem that they're having. This is a phenomenal test, a phenomenal value, and I'm telling you, this is a great test. And like it says down on the bottom, I repeat, it's a Nobel Prize winner. Okay. Next, we have our neurological psych panel. And this one studies 31 SNPs. Who needs this panel? Well, pretty much anybody that's dealt with adult ADD or ADHD, headaches or migraine clusters, seizure disorders, vertigo or dizziness, bipolar, depression, anxiety, kind of lumped together there, schizophrenia, and again, here we go, Alzheimer's, Parkinson's, and dementia. So this is our retail equivalent to the no-cost APD test. The next panel we're going to talk about really briefly is the gastrointestinal or the GI panel, and this one looks at 12 SNPs. And who needs this panel? Well, anyone complaining of stomach or intestinal problems, people that have known food allergies like gluten or casein or lactose, IBS again pops up, chronic constipation or diarrhea, intermittent intestinal pain, chronic reflux, the people that are swallowing Tums every night before they go to bed, mast cell disorder, obesity, diabetes, skin conditions. Again, IBS is so important. We put it in there twice, and depression. So this GI panel is a great one for people, people that know that they have problems, they just don't know what they are. People that eat certain food get constipated, or people that eat certain foods, they get diarrhea, they have stomach pain, they know they're having issues. Trust me, these people know they have problems because of the pain levels. Neurotransmitters panel studies 11 SNPs. And who needs this panel? Well, pretty much quite a wide variety of people here. We've got anxiety, depression, bipolar again pops up, cognition problems, ADHD. But here's the thing. This one's a little bit different than the other ones because this is going to consider a wide range of problems. Insomnia, weight issues, hormone and adrenal dysfunction, memory issues fall in the cognition category, migraines and headaches. So this is for somebody that isn't really experiencing any physical symptoms other than maybe some weight issues, fluctuation of weight. So it's another panel to help out. Next thing we got is our detox panel. This one studies 13 SNPs, and who needs this panel? Well, people with gut complications. Again, you'll see a lot of weight loss stuff in these panels, right? You'll see them repeating, and you're wondering, well, wait a minute, I'm seeing the weight loss come up here, here, and here. We'll talk about that. Known detox issues and a general unwell feeling. Well, these people here that need this panel are pretty much people that are not dealing with anything neurological. It's mostly physical, and it's mostly digestive, okay? And so we've got our GI panel. It can be confusing. We have our detox panel, all right? So they're not experiencing any kind of a reaction to a certain food like lactose or gluten, but they just have this bad feeling. It's a general unwell feeling. They just don't know what's going on, all right? The autoimmune inflammatory panel. This one looks at 30 SNPs. Who needs this panel? Asthma, okay? Respiratory issues also fall into this category. Anyone with chronic infections, skin issues, eczema and psoriasis, people with rheumatoid arthritis or even joint pain, lupus, Sjögren's, and Hashimoto's also fall into this category, and immune weakness. So these people, you will run into them. They're having issues. They know what their issues are. When they see the list and the menu, they'll know this one's for me. Of course, can't forget the PGX test, right? The pharmacogenomic panel covers 16 SNPs. And who needs this panel? Anybody on 2 or more prescriptions. This panel is going to let them know how they metabolize over 300 different medications, all right? If you recall, people fall into certain categories. Slow metabolizers, ultra metabolizers, etc. So when these pharmaceutical companies are designing drugs, they're designing drugs for people that fall into the normal category, which means that they will ingest the medicine, and the medicine will go to where it's designed to go to, and then leave the body when it's designed to leave the body. People have problem with these, with these medications. Again, the number 3 or number 4 killer, depending on your statistics. And this test right here speaks for itself. You should have no questions on the PGX test. But we have a retail component here, a retail alternative. If they're not on Medicare and they don't qualify that way, with an HMO or whatever, this is a great way to help them out still. Last but not least, we've got the Cannabis Health Panel. And this one studies over 150 SNPs. That's right. The Cannabis Health Panel is kind of considered to be a novelty in some circles. But who needs this panel? Anyone using cannabis products. Why? It's going to tell them what formulas to look for, what terpenes to look for, what cannabinoids to look for, what to avoid. It also gives them a really good insight on their likelihood for chemical abuse, their likelihood for different mental issues when they're using cannabis. Remember, our Cannabis Health Report does not discriminate based on state regulation. It is just the cannabis product in general. And if you recall, cannabis has several different versions. The most popular one right now is CBD. And, of course, you get marijuana from cannabis, and you also get hashish from cannabis. So the Cannabis Health Report is going to show people, based on their usage, what they should be taking, how much, and which method. Now, again, this is not a panel that should not be laughed at. People can go out and get euphoria or a high, they call it, by smoking marijuana. That's not what this is for. This is for people that are using cannabis for medicinal purposes. Anxiety, sleep disorders, okay, and pain. Those are the 3 reasons why people will use cannabis legally, and that's what we deal with. All right. So what I'm going to do now is I'm going to stop the recording. Actually, that's not true. Let me go back. So let's get into how we are going to recommend these panels. You show somebody a brochure, which you'll see there's a new color brochure in the download section. You print it out, and you hand it to somebody, and they're like, wow, which one do I use? So let me see if I can open up that brochure real quick. All right, here's the new brochure. They open it up, and they see these choices, okay? Well, I've got these problems here. I got these problems here. I got these problems here. Which panel do I use? Well, here's how we're going to look at this. We're going to kind of categorize this. When somebody comes to you and says, yeah, I've got stuff in all of these sections, okay, or 4 or 5 of these sections, which one should I get now? Because if you recall, our reports will also recommend what? Therapies, lifestyle changes, and additional testing recommended. But if you're trying to get the most bang for the buck, you kind of want to shoot, where it's more effective. So people will say, I got these issues, and they're falling in all these categories. Here's how we look at it. The very first thing, okay, you narrow it down, will be inflammation, okay, or unwell feelings. So if they're telling you I have this, this, and this, you have to know, well, that's going to be very uncomfortable for them, so we want to deal with the feel-good part, okay? So what we want to do is go from the top, and the top is, again, inflammation or pain, then autophagy, how they're detoxing, and then from there we can proceed. But if you have questions, do not hesitate to call the office, and we'll help you guys out. Or send me an email, send us an email, I'll help you pick out a panel. I'm dealing with a lady right now that has 3 children, and they've got issues across the board. So what we're doing is we're trying to get her pointed in the right direction. The way we're going to be doing that is with the methodology of make the patient feel good first, and then we can look at the other issues. If that doesn't make sense, we'll talk about it after the call. You have to make the patient feel better first. So if we're dealing with pain, that's at the top of the list. Inflammation is at the top of the list. Then we can deal with the nutrition and that thing as we go down. But if you've got somebody that has multiple issues, and if you have any doubts, direct that person to send us an email, make a phone call during working hours, and we'll help you guys out. So again, this is a new brochure. Okay. Now, another thing we want to talk about here, there's no visual at this point, is that these events, okay, that you guys are going to. So here's what I'm seeing is happening. We're setting up a booth. We're talking about PGX and CGX, our no-cost test. Now just picture this. You're somebody that's in their, Medicare age. They come up to your booth. What's this all about? You tell them, and then you tell them what the qualifications are to get the no-cost test. You find out they don't qualify. Now what do? Now what you do is you say, but by the way, we have these retail panels, okay? And so we're pitching them on a no-cost test. They don't qualify. Now we're going to go show them how, if they write a check, they can still get some, answers to their questions. Well, I'm going to tell you something. That, to me, as a consumer, does not make any sense. As a matter of fact, it makes me feel like a bait and switch. Okay, so what we want to do is this. We want to kind of flip the script, flip it over to be this. We're a genetic testing company. If you have issues in the following areas, we can help you. Okay, and these are direct-to-consumer panels, and this is how we can help you. And then you start talking with them. They reveal that they're of Medicare age. And then you can say, oh, by the way, you may qualify for a no-cost test. So listen, it's a lot easier pill to swallow, no pun intended, when you are presented with a out-of-pocket cost, and then you are also relieved by seeing that there may be a possibility to get a no-cost test. If that makes sense, then keep doing it, because that's the way to do it. Go high, then low, not the opposite, low, then high. So keep that in mind, that you're a genetic testing company representative. we can help everybody. And then we have this possibility of the no-cost test. It'll make a lot more sense to the customer. Your sales will skyrocket, and everybody will be happier. All right, so I'm going to go ahead and I'm going to stop the recording and start taking some questions.